Here, you will change into a hospital gown and socks. Staff will provide you with chlorhexidine wipes. It's important that you do this before surgery to prevent infections. You will meet our care team, which includes your nurses, anesthesia providers, and surgeon. They will check your vital signs, place an IV line, apply a device to keep you warm during surgery, and give you any medication that might be ordered for you before your surgery. Each team member will have questions about your health. You may notice they ask the same questions: your name, date of birth, what kind of surgery you're having, and the site where the surgery will be done. These are asked for your safety, and you can help by answering the questions every time. We make every effort to be on time for your surgery, but occasionally delays can occur. We will keep you informed throughout the entire process. The team will perform a huddle to verify your name and date of birth, as well as the surgery that you're having, prior to taking you to the operating room. From here, your family will be directed back to the waiting area, and you will be brought to the operating room.